Alright, so today we're going to do manual resuscitation with an Ambu bag with the oral airway in place. So I'm going to come into the patient's room, knock and enter, and I'm going to introduce myself and my department and also give them an explanation of what I'm going to be doing. I'm going to come in and I'm going to assess the patient, and I see the need for the patient to be manually ventilated. And so what I'm going to do is go ahead and wash my hands and apply gloves. And then I'm going to assess the patient. So I'm going to be listening for breath sounds. I'm going to check their pulse. I'm going to check their breathing pattern, their SpO2. And I see the need for this patient to be manually ventilated. And so what I'm going to do is I'm going to place this oral airway. And to do that, first thing I need to do is use the chin tilt method to open up the airway. And then what I'm going to do is place the oral airway. So first I need to make sure that we have the correct size of oral airway. So to do that, I place the flange at the corner of the mouth and it goes to the jaw, so we have the correct size. And so what I need to do is we're going to insert the oral airway toward the soft palate, and then once we get there, we're going to flip it 180 degrees, and then the flange will set against the patient's lips. So go ahead and insert the oral airway. Okay. And then the flange will set at the patient's lips. So I'm checking this patient for pulse, respiratory rate, checking their vitals, and I'm going to go ahead and hook up the oxygen to the Ambu bag so that it fills a reservoir, and then I'm going to manually ventilate my patient. So I'm going to place the mask over the patient's mouth and nose. I'm going to get a firm seal, and then I'm going to begin to manually ventilate my patient at 12 to 20 breaths per minute. And I'm also going to try to ventilate the patient with their spontaneous breathing if there is any. So if they breathe in, I'm going to help them ventilate while they are spontaneously breathing if possible. I'm going to continue to check for chest expansion, and you can kind of see right here that we have some chest expansion going on when I ventilate. I'm also going to be continuously checking for my patient's pulse. I'm going to be listening for breath sounds as well and their SpO2. And then I'm also going to make sure that I'm getting that good chest expansion, and possibly the mask is not on it with a good seal, and so I need to readjust my mask, and then I will continue to ventilate the patient as long as necessary until they decide to hook the patient to a ventilator or another course of action.